When evaluating an individual with spasticity, there are 3 elements important to consider in your assessment: interview, exam, and investigations.
Certainly there are some things that you can do as a very a baseline screening. You want to ask the person about the spasticity, so the history of it, when did it start becoming problematic, or when did it start at all? What is the pattern of it? Are there certain triggers that they've identified as being a problem? Is it worse at certain times of the day or certain activities? When does it peak in terms of its severity? And those kinds of questions that we typically ask of any medical disorder.
Ask your patient about previous interventions they may have had for their spasticity. You may include non-pharmacological treatments such as hot or cold modalities, stretching, exercise, physiotherapy, acupuncture, or electrical stimulation. Also ask about pharmacological interventions such as topical ointments, oral or injectable medications, intrathecal baclofen, or surgery. Some patients self-medicate with alcohol or non-prescription marijuana, and this is important for you to know.
In terms of the physical exam, it's really important to actually take a really good look at that individual. And I appreciate that can be hard depending on the setting, but even a really full examination from a wheelchair position is extremely beneficial.
Carefully examine the skin for any signs of developing pressure ulcers. If problems are observed, explore the possible causes. External causes can include exposure to new or different surfaces, urinary incontinence causing wetness, or bacterial or fungal infections. Internal causes of skin irritation could include poor diet, smoking, or diabetes. Sometimes joint contractures can contribute to skin irritation as well.
Because you have to think about all the organ systems being potential triggers, you really have to take a look at the whole body. So really take the clothes off, look at the skin, look at the bones, feel the bones, look at the catheter, see if it's blocked. And that's when you start pulling in other people on your team. So for example, if you have a nurse in your clinic with experience with catheters, you might ask them to check the catheter and see, is it blocked? You can do a flush of the catheter and see, is the flow appropriate or not? If the problem doesn't resolve in the short term with that initial screen, then you're going to be looking towards expanding your care network in terms of resources.
The assessing physician should order lab work, including blood and urine analysis. X-ray imaging of the abdomen can be used to evaluate fecal impaction. Utilize ultrasound or CT/KUB to examine the bladder. If necessary, refer to a urologist familiar with bladder problems and spinal cord injury.
So if those typical bowel, bladder, and skin issues haven't been identified as triggers and the spasticity persists and worsens, I highly recommend a referral earlier rather than later, because these referrals can take time. That can guide the treatment of spasticity until a good regimen has been found, and then the individual can go back to their center for their usual care and only be seen on an as-needed basis by these specialized centers should there be any changes in their spasticity and the spasticity management. Other people that you can pull into your care network are therapists. So if you have excluded a problem with problematic spasticity, and you would like some help treating it non-pharmacologically, then referral to a physiotherapist with neurological training may be helpful, because certain non-pharmacological management strategies like stretching can be actually quite helpful in the management of spasticity.
It is generally recommended the client be reassessed approximately every 6 weeks after the new interventions are introduced. This allows the clinician or team to assess the effectiveness of the interventions and guide further management of the person's spasticity. Once spasticity management is optimized, frequent reassessments will not be required.